it is helpful for you to see the journey that we've been on and the hurdles and challenges and opportunities that it's presented. But just before I go into that, I'll just give a brief overview of LCVS and who we are and what we do, and a little about the sector so that you've got that background context. I know there's some sector colleagues on the call as well, so just be patient with me. So LCVS was established in 1909, so for over a century we've been working to improve the well-being of individuals and communities in Liverpool, and we do that through supporting and encouraging charitable giving, voluntary action, and by bringing people and organisations and resources together, ideally to make things better, although we'll, seeing the state of Liverpool at the moment, that's debatable. So we are what's called an infrastructure organisation. So we are the sort of back office networker, convener, energy galvanizer of the sector in Liverpool. And unlike some other CVSs in other areas of the borough or the country, we don't actually do service delivery at all because we've got a very robust sector in the city. So our priority is to support them to do what they do best. Our priority areas are education, health and well-being, poverty and justice, arts and culture. We've just undergone a stakeholder engagement piece, again, another piece of work we've done with Liverpool Hope University to have a conversation around poverty and the eradication of poverty in the city and what LCVS's role is as a galvanizer of the sector in doing that. And that's going to be our focus for the next 5 years. So once that, I might come back and talk about that another time if Claire lets me. So our services, we provide support, advice, training, networking and representation for the voluntary community and faith sector across the city and across the city region. We help donors distribute over £4 million of funding every year to charitable organisations, both here in the UK and across the world, but predominantly with a focus in Liverpool. We support private individuals and private trusts, acting as secretariat and treasurer and managing over £20 million of investments on their behalf. And we are a strategic partner in the city, representing the voluntary sector. We have a seat on the board of the Integrated Care Partnership, the Health and Wellbeing Board, and the Liverpool Strategic Partnership. And we have developed a strategic network of voluntary sector organisations, which is linked into the new healthcare system from place-based through to Cheshire and Merseyside regional level, with the aim of influencing service delivery and policy and advocating for that sector. So a little bit about the voluntary sector in Liverpool. Voluntary sectors are sort of one of those generic terms that refers to organisations whose primary purpose is to create social impact rather than profit. So there's loads of interchangeable terms used. It's often called the third sector, civil society or not-for-profit. These figures I've got here are from the 2019 State of the Sector Survey report, which has just about to be updated. We've just completed working on that with colleagues, and that should be coming out in the coming months. But the figures show that there are over 3,000 voluntary organisations in the city, employing around 10,000 FTEs and providing an economic contribution of 394 million, which is 4% of the city's total gross value added, which is not a small amount when you consider it. Liverpool contains a higher proportion of larger voluntary sector organisations with an income above 100,000 than the national and city region averages, while a third of organisations in Liverpool have an income above 100,000. The national and city region proportion stands at 23% and 28% respectively. And in Liverpool, as you can see there, the voluntary sector plays a key role in a wide range of service delivery, advice giving and community development. So just to give a broader broader context of the sector at the moment, obviously we've come out of COVID, we've gone into the cost of living crisis. The have to a charity resilience index they produce quarterly, and they've just published that charities survived the difficult winter. They continue to struggle to meet costs and provide for those that need them, despite the economic climate looking a little bit more positive. They surveyed 600 charity leaders between April and May this year from across the UK, and the results show that charities have entered a protracted period of rising demand, increased costs, and falling donation income. 81% of charities say that demand for their services has increased compared to a year ago. Less than 2/5 of charities have high levels of confidence that they can afford to meet the current demand for their services, and just over half of charities are confident that they can meet their current overheads, and that includes energy, rent, and supplies. Staffing is emerging as a major issue for many charities, with 60% struggling to recruit or retain suitably qualified candidates or volunteers. People are just not moving. People are staying where they are. People are looking for higher wages as cost of living bites. 7 in 10 charities now say that the rising cost of living is affecting workforce morale, compared to 53% at the start of this year. So it's a really challenging environment, and I think it's really important that when colleagues are looking to work together with the voluntary sector, we understand the context and the real challenges that they're facing. The sector is very lean by nature anyway. It doesn't have a lot of resourcing. It doesn't have a lot of capacity that's just sitting around. It's always been fleet of foot and very reactive, and able to sort of spin on a sixpence, which is what makes it attractive to partners in working with it, but it's also makes it really challenging in terms of finding that time to do work with them. So, to our experience working with academic partners, way back following Black Lives Matter, the work we were doing in communities, we noticed that Black-led organisations appeared to receive disproportionate level of funding than other voluntary organisations and other Black-led organisations in other parts of the country, predominantly down south, it must be said. And we were having conversations with organisations across the country and locally, and we kind of thought, is this real? Is this something that we're really seeing? We wanted to understand why this was happening. Was it a lack of capacity to raise funds? Was it a lack of capacity to write funding bids? Was it the way funders' application processes work? Are their processes inclusive and supportive? Are they exclusionary? Is it a regional issue? Is it an issue at all, or are we, reading into something that isn't actually there? But we wanted to explore this sort of hypothesis. And the intention was that we wanted to explore this, and that the answer to that question would inform not only the development of our services as a capacity building organisation. We were hoping that if we saw where the need was for these organisations, we could develop support services to support the sector to progress and to be sustainable, but also use this information as potentially enabling an evidence-based conversation with local, regional and national funders about any discrepancy and how they could address that, and how we could work together to address the areas of concern. So we began our research journey in June 2022. We had a potential funder on board at that point, and we had a question that we wanted exploring. What we needed was an independent partner, university, to undertake the research to ensure that it was robust and evidence-based. We had an informal understanding of the issue, but we wanted to be able to have that robust evidence on which to base not only our decisions, but conversations with funders and the wider sector. We did approach CoREN for a starter for 10 conversation, but as it wasn't a specific health related sort of research piece, it didn't quite fit. So we were put in touch with the NIHR Research Design Service, and we had conversations and emails with them. And I must say, this fell at the first hurdle, because the inquiry form that they wanted us to fill in was really complicated and full of HEI references that we didn't understand, weren't relevant, and we just couldn't fill in the form. So I would say 60% of the form was not relevant to us. We couldn't fill it in. And then we didn't fit the system because we couldn't fill the form in. So it was a kind of computer says no situation. So that didn't really go anywhere. We then did find a university who was potentially interested, and we had a few conversations with them, but they wanted us to undertake a kind of pilot research phase ourselves and then bring that to them so that they could then apply for funding to do a longer research study. We don't have the resources or the capacity or the knowledge or expertise to do that. That's why we were looking for a research partner. And I also wasn't confident that they understood where we were coming from, what the sector did, how it worked, and what we wanted to do. And it very quickly kind of morphed into this conversation around, well, this is how we do things. You need to follow our processes. This fits our agenda this way. And what we were really looking for was a partner to have a conversation and say, hey guys, this is a really interesting concept. You've got that concept from lived experience. Let's explore it further. You provide the context and networks to the voluntary sector, and we will provide the experience and expertise about the research methodology and how to go about answering the question. And it was that kind of partnership that we were seeking. Finally, in July 22, we contacted Liverpool John Moores University through a friend of a friend to see if they could help us out. They went off to colleagues and kind of schlepped it around the university to see if anybody was interested in doing anything. You then had the summer hiatus and start of term and all of that interruption. So by February 23, we lost our funder, which was incredibly disheartening, as we were really convinced that this would be a really good piece of work to do, but the funder had lost interest because of the delay. There's only so many times you can go back and go, we're working on it. There's no progress. We then approached the Combined Authority Research Quality Hub, again through a friend of a friend, to say, look, we're getting nowhere. We're really keen to do this. Is there any way you can help us? They expressed an interest and were really keen to support. And this was sort of the crucial turning point, really, as they were able then to put their weight behind it, which meant that then the university decided, oh, actually, this is going to be a thing that's going to be done, and it might, we'll get on board. The Race Equality Hub also offered to provide some funding and resource from their own research team. There was a compromise that needed to be made, as there always is, was that they wanted the research to be undertaken across the whole of the city region, not just Liverpool, which again is absolutely fine, but it meant that I then had to go and have conversations with CVS colleagues across the city region to gain buy-in to the principle of them supporting this project and giving us access to their networks of organisations, because each CVS only works within its own borough or city. And there's a very sort of informal agreement that you don't go onto anybody else's patch. So you work collaboratively rather than we wouldn't as Liverpool CVS go into Knowsley or Sefton and just start working with their voluntary sector. That's not how it's done. So you sort of have to work collaboratively and in partnership to get access to those groups. So by March 23, we're now 10 months in, we had our first meeting about the project with Liverpool John Moores University. Between April and July, we had a working group looking at the definition of the problem statement, the methodology, how it was going to be funded and how that funding split was going to work, who's going to be working on it, what level they're going to be working on it. And there was also a lot of time given to educating academics about how the sector works. That whole context that I've given you means that, when you go into an organisation and say, hey, we want to do some research, or can you give us some time with research? they're juggling their time. So it's, an hour with you or an hour spent potentially working with somebody who's in a really difficult situation, who can't feed their children or is about to lose their home or is suffering domestic abuse, or, so they're real life diary juggles that people are making every day. So that the context of that needed to be understood also. There were challenges around what the definition of non-profit was, and the legal definition of that to the definition of what we were going to be doing in terms of the context of who we work with. There were challenges around defining the baseline and how many organisations would need to be involved to make the research valid. Because we didn't have any information about, for example, how many Black-led organisations exist in the city region. We just don't have that information, so we couldn't say, right, we need to interview 10 or 20, or we just have no idea. And we also couldn't presume. There was this whole thing around opting in. How are we going to get organisations to opt in? We can't direct approach organisations and say, hey, we think you're a Black-led organisation. We have to say, our understanding of what Black-led means is this, so that organisations go, oh yeah, that is us, we'll opt in. So all these sort of intricate little things came out that we needed to work through in order to get to a point where we can launch the programme. We also wanted to make sure that the programme was beneficial to organisations taking part, and that they understood what they could possibly get out of it as well. So coming up with the sort of communication around that has taken some time as well. So it's only sort of August, September time that we've got to the stage of the ethics approval, which is going through at the moment, with the view that the research will start during Black History Month in October, take around 12 months. So the time from us initially looking to partner with an organisation to do this research to the point of actually getting it launched is 16 months, which is quite a long period of time. So what did we learn through the process? We know that the voluntary sector has a wealth of knowledge and information that could be of use to academic researchers, policymakers, funders, and the sector itself. It's a hugely untapped resource. And the more the voluntary sector now is getting involved in the new healthcare system in terms of delivering services, being brought into the fold, as it were, in terms of linking, community services with voluntary sector services to support people in need, the more information could be gathered around social determinants of health to frame policy and service delivery. And that could inform system change. So it's a really exciting opportunity if we can get the partnership right. So, for example, Liverpool CVS are supporting Liverpool City Council's HDRC bid. So we are awaiting a decision on that. It's highly competitive, but we're waiting on a decision on that at the end of October. They're looking to embed research into and data insights into their decisions on what services are going to be delivered by the council and how those services are going to be delivered in neighbourhoods. And they've got a whole bid around how that's going to be done. We're supporting it as is Health Watch. We're providing the insight into voluntary sector organisations, into leadership at place, community leadership at place. We're being the critical friend around their methodology on how they're going to do that, with a dash of realism about all the context we've spoken about already. But that would be a really exciting opportunity to look at how collaborative work with data insights and information gathered from lived experience can be used in service development. The challenges that we found were timescales. We had absolutely no idea about the timescales. We're very fleet of foot, responsive. We were looking to do something quite quickly with a turnaround. We thought, oh, we'll get this done in 6 months. And we just had no concept of all the processes, you know, that you have to go through as a university to get funding, and to get a research project off the ground, and you know, you all your approvals and your ethics and all of this. We you know, we were clueless. So timescales is could be challenging if you know, if you see a need as a community organisation on the ground and you think, right, we need to develop something in relation to this, we'd like some proper research to back it up. You can't wait 16 months to do that when the issue is imminent. So something around how do we shortcut that, and how do we work together to solve that problem? Hope reduction is absolutely key, I think, to this. And this is something that we've discussed at the CoREN Leadership team, around listening to the voluntary sector and their experiences, seeing how these experiences can inform academic research, rather than, you know, academics coming going, oh, well, we'd like to research this, or I've got a personal interest in this and I'd like to research this. It needs to be beneficial to both parties, as I said. So you know, it's done to inform system change or service delivery, you know, challenging issues around some key issues affecting society that directly involves the organisation, and what they do on a day-to-day basis, and their service users and how they're affected. I think voluntary sector is really interested in action-based research rather than just theoretical knowledge, because it doesn't help them. They need information to change their services, evidence the value of what they're doing, or evidence the need for what they're doing to funders or other partners. So it's around that matching between what you're looking for and what you need in terms of your academic research and what you find valuable, and what the sector can offer and what it finds valuable, and the time it has to give. And those two things aren't necessarily on the same level at the moment. I think that they come from different viewpoints. Navigating the system was really problematic, as I've outlined. It's not our world. We don't, you know, if you're looking at really smaller grassroots organisations, or even the medium-sized voluntary sector, they don't have policy people. They don't have researchers. It's not our world. We don't speak the language. You know, my husband's a professor at the University of Liverpool, and I struggled to get through the process. So you know, it is a foreign world to us. So translating that in some way is needed. And there's no standardized system or process for the sector to get involved or put out a query. You know, there's no single point of entry, if you like. We got there by luck, and we knew a couple of people who knew a couple of people, and it was a friend of a friend. So the way forward, I don't have the answer. This is just our experience to date, and it's still ongoing. And you know, more than happy to come back and tell you what the outcome was at the end of it. But the academic world is huge, complex, an organism, and it's alien world to us. We don't have the answer to that. Probably oversimplifying it, but it would be really great to have a standardized entry system where we could post, you know, hey, we've got a concept, or we've got an idea that we'd like testing. Is anybody interested in joining us on that journey? You know, a kind of matchmaking facility would be, you know, you might all be rolling your eyes at me at this point, I don't know, but always like that matchmaking facility would be brilliant. We couldn't find an easy way in. As I said, we got there through a friend of a friend. There's a huge amount of information being captured daily by voluntary sector organisations. And the challenge is, how do we capture that easily without making it an added burden? As I've said, it needs to be beneficial for the sector as well to get involved. Otherwise, you're vying for their time when they could be working with marginalised people. So we need to be able to demonstrate that the time is worth putting aside for it, because it does drive policy, or it does enable you to provide, you know, prove social value or attract funding. It does develop your service. So it has to be that you know, two-way street. So that's sort of all I had to say really at that point. Was sort of, that's our journey, whistle stop tour of our journey. Come out of this now. She's pressing a button she hopes doesn't just end everything.